name is Nicole. I'm going to be your nurse today. I'm going to start by stating the equipment I have with me. I have my stethoscope, my pen light, gloves for infection control. I'm going to sanitize. And I'm going to clean my stethoscope. All right. I'm going to ask you a few questions. Do you have any pain or discomfort right now?
Nope.
Do you use any assistive devices?
Nope.
All right. If you have experienced any pain during this, please just let me know. Can you state your name for me?
Ashley Stearns.
And where are we?
The doctor's office.
And what's today's date?
Saturday, November 21st.
Okay, patient is alert and oriented ×3. There is no slurred speech, and she is appropriately oriented. And her level of consciousness is appropriate as well. I'm going to ask the patient to raise her eyebrows, puff out her cheeks, smile, frown, and I'm going to have her shrug against my hands. Patient's cranial and spinal nerves are intact. Can I have you close your eyes for me? I'm going to touch you. Can you please repeat where I'm touching?
Right foot, left thigh, right arm, left cheek.
Patient's sensations are intact, and she could repeat to me on her upper, lower, and face where I was touching her. I'm going to ask you to remember 3 words for me.
Okay.
Apple,
Apple,
bucket,
bucket,
elephant.
elephant.
All right, and I'm going to ask you those later on.
Okay.
Can you touch your fingers to your thumbs? Patient's fine motor skills are intact. I'm going to have you stand up, and I'm going to test your gait. And walk back to me. Patient's posture was appropriate. There was no swaying or evidence of stumbling or falling. I'm going to ask you to stand on one foot and then the other. All right, and put your arms out and close your eyes. All right, put your arms down and open your eyes. Patient's balance and coordination was intact as well. I'm going to have you dive forward. I'm going to assess her spine. All right, there was nothing palpable. There's no evidence of curvature, which means there's no scoliosis, kyphosis, or lordosis. I'm going to ask the patient to move her arms in a big circle. I'm going to test her range of motion. There's no evidence of crepitus, elbow. All right, there's no evidence of crepitus in her wrist. No evidence of crepitus. No evidence of crepitus in that arm, this elbow, or this wrist. I'm going to ask the patient to do her lower extremities as well. Move your hip forward, backwards, side to side. No evidence of crepitus along with her knee. No crepitus evident. Move forward, backwards, side, side. No crepitus. Is there any pain in any of these?
Nope.
All right. And I'm also going to test her upper extremities strength. So if you can push down, up, inwards, and outwards. Okay, patient's upper extremities are 5 out of 5. I'm going to assess her hands right now. There's no evidence of clubbing. I'm going to test her capillary refill. Both were under 3 seconds. I'm going to test her skin turgor. There's no tenting on either side, which means she's adequately hydrated. I'm going to test her radial pulses. And they were there, both 2+ bilaterally, with no abnormal rates or rhythms. All right. I'm going to have you sit back down. I'm going to assess my patient's head and neck. I'm going to put my hand sanitize for infection control and put my gloves on. I'm actually gonna, can I just look at your extremities one more
Yeah.
time?
Absolutely.
Her skin on her upper extremities is warm and dry to the touch and pink. There is no evidence of any rashes, bumps, or bruises. Her face is also aligned properly. There is no deviation. Her trachea is aligned as well, and her neck and head are appropriate for her body. Her face is pink and looks well moisturized and is dry to the touch. I'm going to assess her scalp. There's no evidence of critters. Her hair is distributed evenly along her scalp. Her texture and color is appropriate as well. Her eyebrow and eyelash hairs are distributed evenly as well. Now I am going to ask her to open her mouth. I'm going to test for TMJ. There's no evidence of crepitus, so that I do not suspect any TMJ. I am going to ask her to swallow. I could feel her swallowing, and her swallowing is intact, and I could not feel her thyroid, and there is no goiter present. I'm going to assess my patient's ears. Ears look good. There's no evident bumps, rashes. I'm going to look in them. There's no drainage. There's no drainage. I'm going to perform the whisper test and ask my patient to tell me what I'm saying. Hello? Goodbye. Do you have any trouble hearing? Nope. Okay, the patient reports no trouble hearing, and she could recall the words that I said back to her. Now I'm going to look at my patient's eyes. Her sclera is white and no evidence of jaundice. I'm going to look at her conjunctiva. It is pink and there is no discharge present. Her pupils are 4 millimeters and they're equal on either side and symmetric. Her irises are green and they are symmetric as well. I'm going to perform a light test and look at the response of her pupils. They constrict consensually, and now I'm going to perform the accommodation test. Okay, she passed. Her eyes are accommodating well and constricting consensually as well. I'm going to ask her to follow my pen, and we're going to perform the cardinal field of vision test. Okay, patient passed the 6 cardinal fields of vision test. Now I'm going to assess my patient's nose. It has appropriate size and shape for the face. There appears to be no drainage present. I'm going to ask her to look up. There appears to be no deviated septum. Do you have any trouble smelling?
Nope.
I'm going to ask you to close one nostril. Smell. Close the other. Do the same thing. Was there any problems? Nope. Patient reports no problems with smelling. I'm going to assess her mouth now. Her lips look pink and moisturized. No evidence of cyanosis. I'm going to ask the patient to open her mouth. There's no evidence of cyanosis as well. Her tongue and membranes are pink and they look well hydrated. There was no evidence of plaque on her teeth, and her tonsils were apparent, and her uvula was centered midline. I'm going to ask the patient to stick out her tongue. Her tongue did not deviate, and there is no odor present. Right, I'm going to feel her pericardium. Alright, there was no abnormalities felt. There looks to be no labor associated with her heart or her lungs.
Actually, I'm gonna put these back on.
Do you mind if I feel your sinuses and your lymph nodes?
No.
And if there's any pain, do you feel any pain? All right, there was nothing felt. Did you experience any pain during that?
Nope.
Patient reports no pain, so her sinuses and her lymph nodes appear appropriate. I'm going to auscultate her heart now. All right, heart sounds were heard bilaterally. There were no abnormal rates or rhythms. I could hear her S1 and S2, which means that her tricuspid and mitral valves were functioning properly, and there's no sounds of whooshing. I'm going to ask my patient to stand up so I can assess her lungs now. You could turn that way. If you could take a big, deep breath for me. All right, her lungs are expanding properly. There is no evidence of labored breathing, and I'm going to auscultate. Take a deep breath. Take a deep breath. Deep breath. Another deep breath. You could raise this arm and take a deep breath. Raise this arm, take a deep breath. And turn towards me. Another deep breath. And another deep. All right. Her lungs sounded great. There was no evidence of bronchi, crackles, or wheezing. There were sounds evident bilaterally. There was no abnormal sounds. I'm going to have you sit back down and actually lay down with your legs up. And I'm going to assess for vascular and bowel sounds. Do you mind if I lift your shirt?
No.
Before auscultating, I'm going to look at her stomach. There's no abnormal distension present. Now I'm going to auscultate. Bowel sounds were present in all four quadrants. There are no abnormalities. There's no abnormalities with her vascular sounds, which means that there's not an aortic aneurysm. I'm going to palpate your stomach, so if you could tell me if there's any pain or discomfort. Any pain?
No.
Any pain?
No.
Any pain?
No.
Any pain?
No.
Okay, there is no pain present. While she's laying, I'm going to assess her lower extremities range of motion. So if you could please move your ankle in a circle. Okay, there's no crepitus. Ankle in a circle. There's no crepitus in that ankle either. And if you could wiggle your toes for me. Perfect. I'm going to assess her capillary refill, which is under 3 seconds. I'm going to do her skin turgor. No tenting present, which means she's adequately hydrated. And her lower extremities look pink. They are warm and dry to the touch. Now I'm going to assess her pedal pulses, her posterior tibialis, and her dorsal pedis. And they're both present, equal bilaterally, 2 plus. And I'm going to ask you to swing your legs forward. And we're going to do the strength of her lower extremities. If you could push up against my hand, down, up, and back down. Her lower extremities were a 5 out of 5. And do you remember those 3 words I asked you to remember in the beginning?
Yep. Apple, bucket, and elephant.
Okay, and her short-term memory is intact. Right. Thank you.